Let's talk about the ABO blood typing. Let's talk about that for just a minute. Let's look at A, B, AB, and O. Type A blood has antigenic markers that mark it as A, and B has a different set of markers. And AB has both. Has both A and B. Type A blood has anti-B antibodies. Type B has anti-A antibodies. Type AB doesn't have any antibodies, and type O has both. Like this. So what happens is if a person donated B to A, then this antibody would latch onto this site and lock it down. And if you get a lot of that, you can a blood cell can be disabled. It can clump together, agglutinate, and cause a stroke. Not cool. So it's important to donate blood to a recipient that is appropriate. And so one of the problems that I had is I looked at type O blood and I was thinking, well, wait a minute. O has antibodies to A and B. So why is it called the universal donor? And what I found is, yeah, O negative specifically is a universal donor, but it should be donated in a small amount and slowly so that these antibodies don't lock on and clump any one blood cell too much. So apparently you can do that. There's another issue is that let's do B, that some people's cells have an RH factor on them, and that makes them positive. If the other ones don't have it, then they're called negative. So what does this mean? What this means is that if the mama, give her a little bit more room for this baby, if the mama has a baby that is RH positive and she's RH negative, interestingly enough, the first baby's safe because the blood doesn't mix inside the mom and the baby. It's only at the time of the delivery, when the placenta detaches, that there's mixing of the blood. Or if there was a miscarriage or an abortion, those would also incite this response. The mother's body would then produce antibodies to this RH factor, and the next child would be the one at risk if it was positive. If it's RH negative, then the next baby's not at risk. If the mom is RH positive, none of the babies are at risk, because that would mean she would be producing something to her baby that she would also be attacking her. That doesn't make sense. This produces, if the attack occurs on the second child, it's called erythroblastosis fetalis. And I looked this up and I found out that not only can an RH factor difference cause a problem between the mom and the baby, but an ABO blood difference. If the mother has type O blood and the baby's type B, she can attack the baby because of the blood type difference. So that does produce the same problem, but a lesser magnitude of problem apparently when it's just a blood type difference. So we learned, or I learned, that O negative is a universal donor. The negative is important because as the blood would be donated to the host, there would be nothing to trigger an RH response in the recipient. Okay, let me say that one more time. As the donor donated O negative blood to the recipient would not develop a response to an RH factor because there would be none in O negative blood. And then apparently the universal plasma donor is AB. Why? Because there are no antibodies to blood in it. So that would be the universal plasma donor is AB. And I would guess AB negative would be best.